All right, ladies, do you have your Valentine's Day outfit chosen yet? Maybe it's a skirt or a dress, or maybe you're thinking, you know what, I'm just going to wear pants. I don't want to show off my legs because of varicose veins. My next guest says she can help you. Dr. Nisha Bunke from Jolla Vein Care is here this morning. Dr. Bunke, thank you so much for coming in. We do appreciate your help.
Good morning.
I think a lot of people associate treatment for varicose veins something that's very painful, requires an extensive surgery, and they're already dealing with varicose veins. They don't want to add on to the pain on top of that. Is there a big myth involving the treatment for veins?
Absolutely. Most people think that vein stripping surgery is the only way to get rid of veins, but the truth is vein stripping surgery is nearly obsolete. So there have been newer procedures that have arisen in the past 15 years that have really replaced vein stripping surgery.
Let's talk about two of those. These are both non-surgical, can be done right in your office. One requires local anesthesia, the other one requires absolutely nothing. Let's talk about the first one. It's radio frequency.
Right, so radiofrequency ablation or endovenous ablation is another name for it. So what we do for this procedure, this is a replacement for vein stripping surgery. So we use it to treat those larger veins like the great saphenous vein that used to be required to be cut out. So now we can just close it down by inserting a thin, flexible tube into the vein, and then we deliver radiofrequency energy. Radiofrequency energy converts to heat that'll cause the vein to shut and collapse and gradually dissolve.
Now we're looking at some animation right now. Does this one require the anesthesia?
So this requires a local anesthetic. So none of the newer procedures require you to be under general anesthesia. So this is done in the office. The procedure takes less than an hour, and we use a local anesthetic to surround the vein.
Fantastic. Then get right back to activities right after this is done.
Right.
When will they actually notice a big difference?
Yeah, it can. So a lot of people notice that their legs feel better within a couple of weeks. Visibly, it can take several weeks for veins to start fading away. And it often requires another treatment called foam sclerotherapy for the more surface varicose veins.
Okay, so let's talk about that treatment. This one actually requires no anesthesia at all.
Right, so foam sclerotherapy is another replacement for vein stripping surgery. And this is used to treat those big bulging veins at the surface of the skin. So what we can do with this is we can inject a medicine, it's a foamed medicine, into the veins that'll cause the veins to collapse, they'll shrink, and they'll gradually dissolve.
Are you amazed by how technology has changed the line of work that you're in?
Absolutely. It's completely revolutionized vein treatments. And so because of this, there's less trauma to the legs, there's no scars, there's no large surgical incisions, so people go back to work right away.
That's amazing. Now you said you got into this first going through medical school and then realizing that there really is a need for doctors to specialize in this because varicose veins can not only be unsightly, but they can be somewhat dangerous for people.
Right, so yeah, my board certification is in venous and lymphatic medicine. So we specialize solely in treating leg vein disorders.
And so talk about for a moment what that can entail. You know, some people say that there's a lot of pain associated with varicose veins. What other symptoms are they sometimes dealing with?
Right, so they can cause a lot of symptoms such as like aching, heaviness, fatigue. Varicose veins and venous insufficiency are one of the most common causes for leg swelling, which a lot of people deal with. They can also cause restless leg syndrome and night cramps.
We're looking at some before and after pictures here. Not only are the veins, especially those ones that are bulging out of the skin, gone, but there is not a trace that they were ever there in the first place. That is how remarkable these procedures are.
Right, yeah, and that's certainly the goal, is to eliminate these veins with as little downtime as possible without much impact in your lifestyle and without having any scars.
Talk about some of your patients who come in for these treatments. Are they amazed about how well these work?
Yeah, we usually hear, I don't know why I waited so long, I wish I would have done this before, but most of the time people have the misconception that vein stripping surgery is the only option to get rid of these veins.
All right, giving a lot of people hope here. I know some people that deal with this, and yeah, they wear pants and long skirts even when it's 100 degrees outside, and that's hard, especially here in Southern California. All right, Dr. Nisha Bunke, Jolla Vein Care. Where are you guys located in La Jolla?
We're located off of Genesee in the Scripps Zymen Medical Building, which is on the campus of Scripps Memorial Hospital in La Jolla.
Parking's really easy. You're great to find. The number's right there on your screen, as well as the website as well, LaJollaVeinCare.com. Mark came over here and lifted his leg and showed you something. How often do people do that and go, what should I do about this? That happen all the time to you?
All the time, every day, every day.
I thought Mark was being strange by doing that, but apparently Mark, even at parties, people are like, can you check this out? What can I do about this? That just goes to show how common this problem is.
Extremely common, yes.
All right, Dr. Nisha Bunke, thank you so much for coming in. I'm sure Mark will be in to visit you guys very soon.